So today we're going to talk about how we use the OCT in neuro-ophthalmology, and as by convention, the OD, the right side, and OS on the left side. And there's this wonderful little color coding here. Green is good, yellow is borderline, and red is bad, obviously. And what we're measuring here is peripapillary retinal nerve fibrillary thickness. So if we're inside the green zone, and this black line represents the patient, if we're inside of the green zone, then we're between the 5th and the 95th percentile for age-matched controls. If we're in the yellow zone, we're borderline, and if we're in the red zone, we're the 99th percent outlier. And so, just with a quick glance, we can see that the machine says we're in the green zone within normal limits. However, you notice that the black line is a little bit above the green, and the machine cannot register when it's above the green. So when it's above the green, that would be white if they had a color scheme for white, but they don't. Some machines actually do this, but ours doesn't. And so when we see that line above the green zone, that's one of the things we're looking for when we're looking for papilledema. So we're looking for thickening of the nerve fibrillary. And so if the black line was way off the scale, that would be very convincing for true disc swelling from thickening of the nerve fibrillary. When it's just borderline like this, it could or could not be true edema. And normally the global in the center here is 100 microns, plus or minus 10, which is one standard deviation. So in this particular patient, we're looking at signal strength, we're looking at the centration of the circle, we're seeing if the segmentation line has been drawn in the right place, we're looking to see if we're in the green zone, the yellow zone, or the red zone. If we're in the red zone, optic atrophy. If we're in the yellow, it's borderline. And if it's in the green zone, we're normally good. But if you have to look at the green and make sure the line is not above the green zone, which would normally be the white zone, and that'd be thickening. So in this particular case, I think these are pretty much within normal limits. So that's how we interpret and look at the OCT very quickly for retinal nerve fibrillary in the peripapillary zone for patients who have optic atrophy or who have disc swelling.